This is Sarnia Lambton Daily for Thursday, March 26th. Good evening, I'm Terry Doyle. The number of positive cases of COVID-19 in Sarnia Lambton has gone up from 5 to 7 tonight. 4 of those patients are in ICU at Blue Water Health. The original 5 patients announced Wednesday range in ages from late 60s through late 80s with no underlying health conditions. These people have no recent history of personal travel. Lambton Public Health is in the process of tracing who these people may have been in contact with to determine if any further testing or self-quarantine is necessary. Lambton Public Health is also looking into reports of a contractor who previously visited the local Shell refinery and then tested positive for COVID-19. The contractor is based outside Canada and came to the region between March 11th and 13th. Medical Officer of Health Dr. Sadit Ranade says the health unit was not originally notified of the case.
We were alerted essentially the same way everyone else was, the social media post of a sign that was posted at the Shell facility. And again, we ask that if people are identifying that or presuming that there was a contact of the case, that they talk to public health first, because you can understand the level of concern that was raised in the community. But our steps in that process are really to go back and identify whether or not that person is a positive case, and to track down kind of either a lab report or a diagnostic finding that was true, and then we can work backwards to say, what was the level of exposure in the community and where did they go and that kind of thing, and then do contact tracing in that way. It's complicated by the fact that the person does not reside in Ontario, and so we're tracing down lab results from other jurisdictions, but that's part of the process that we are engaging in.
Dr. Ranade wants all businesses in the region dealing with a case that could lead to a positive diagnosis of COVID-19 to notify Lambton Public Health.
We would like that. I mean, we're very connected to a lot of different occupational health divisions of different employers, and we would really like to get the heads up from them for a couple of reasons. One is because when a workplace receives that kind of notification, sometimes they only view it through the lens of the workplace, but we know that people who are in town for work go to many different places apart from the work site, right? So their potential exposures are not limited to the work-related exposures that they might have had. So we do ask for that heads up. I don't know that there's necessarily a requirement that they tell us, but we would prefer that.
Travelers returning to Canada after the March break have been told they must quarantine for 14 days, but it appears some people have not been adhering to that. The federal government has taken steps to put more teeth behind those rules, subjecting people to fines and even imprisonment if they do not follow those directions. Returning to Canada, don't stop at the grocery store, don't run errands, immediately into quarantine. Meantime, let's check in with Sarnia Lambton MP Marilyn Gladu, who joins us now. And Marilyn, certainly things have changed in the last couple of weeks as everyone dealing with the pandemic. First of all, how are you and your staff doing?
Well, we're fine. We're not taking any walk-ins, but we are responding to constituents by phone and email, and we're all well.
That's good to hear. So certainly, as what are you hearing from people? Obviously, there's people still, reaching out. As you said, no walk-ins, keeping the staff safe by any means. But certainly, I'm sure you're still hearing from people with their concerns, but also still probably trying to access some federal programs.
Well, yes, the reality is, although Justin Trudeau has talked about $82 billion of aid, there's nothing available to get yet. And the resources just aren't in place to process the number of EI claims that have come along. So people are understandably afraid, and we're hearing heartbreaking every day of people that are going to lose their businesses. They had to lay off employees that have been with them for years. And so people are suffering, and the government is coming with aid. It's just not quick enough.
And I guess, are you finding people, even when they reach out to the office, just to right now hear a voice to say, things are being worked on, or in case of your staff, as they always do, trying to hook them up with some other federal programs that have already been in place outside of the pandemic, where right now it's probably hard to get a hold of anyone. I'm sure even just, your dedicated staff, just hearing their voice has got to be reassuring, especially for some local people.
Absolutely, and the reality is that things are changing quickly and new information is becoming available, and so we have direct lines to help get the services that people need and to answer their questions. People that are returning from overseas that are having difficulty, people that are currently looking at what programs will be available that they could access, and just making sure that the folks have the resources and the support that they need in this difficult time.
Marilyn, we've seen the messaging out there, but as the MP for Sarnia Lambton, what would you tell people right now in terms of making sure they stay safe during this pandemic?
Well, we have 5 cases of COVID-19 in Sarnia Lambton, so I think it's even more important that people self-isolate, stay at home. If you're going to be out at all, social distance by 6 feet away from each person. That's the only way that we're actually going to keep the spread of this virus from, taking us even further down. I'm concerned for our economy, obviously, as is everyone, and we will continue to provide timely updates and make sure that we have the help that we need. I want to give a big shout out to all of the healthcare workers and first line folks who are doing such a wonderful job and putting themselves at risk, I would say, even though they have good protective equipment.
Of course, your roles have included Shadow Minister of Health. I'm assuming with that, certainly keeping a close eye on what's going on, because we know so many people dedicated in the healthcare field dealing with so much, whether it's supply challenges or just day-to-day challenges. I'm sure your heart goes out to them and proud of the work they're doing.
I'm very, very proud of them. I would say I'm a bit disappointed the current health minister with the slow pace at which they implemented pandemic response. It was clear to me at the beginning that we should have been shutting down or at least quarantining or isolating flights from Wuhan. And when other places became hotspots like Iran and Italy, we should have immediately been postponing flights from there. And the information did not get to travelers coming in from other places about self-isolation, and there was no enforcement of that. So I think we really missed an opportunity to nip this in the bud a lot quicker.
And speaking of isolation and self-quarantining, the fact that people coming back from holidays, now the government has said, you must quarantine and sort of maybe putting more teeth into it. But here we are in a border community and certainly impacted by that. We've heard stories that people saying they've seen people coming back from holidays going straight to the grocery store and then continuing on home. And it's one thing we see people in various areas of the province and of the country, but here in a border town, I've got to think that's even more of an issue.
Well, and people are being vigilant. I'm receiving even Facebook messaging from people who are reporting on those who are not self-isolating, and I'm able to escalate those to the health minister, who has the authority to impose fines.
Stepping away from the pandemic for a moment, situation where you have an update in regards to your candidacy for the leadership of the Conservative Party.
Yes, I'm very disappointed to say that yesterday was the deadline to meet the 3,000 signatures and $300,000. Unfortunately, I didn't meet the deadline, and the party decided not to suspend the race, even though 5 of 7 of the members, even some of those on the ballot, said, look, in the middle of a pandemic, nobody can fundraise or get signatures. But however, disappointing, I'm not on the ballot, but I am very proud of my team. I'm proud of how I represented during this leadership race and certainly brought forward some great policy. And many of the other candidates are taking advantage of leveraging that.
Pretty shocked that they didn't put something in place, considering every walk of life right now has some sort of changes.
Honestly, the party is tone deaf. I've been calling out for this since early in March. The Quebec leadership race was suspended. The Newfoundland race was suspended. The Olympics have been suspended. Hockey has been suspended. Honestly, to pretend that anyone could go ask for money when people are losing their jobs, losing their businesses, losing their lives is just, I think, insensitive and offensive.
Marilyn has put maybe a positive spin on it. You touched on it a moment ago, but the people you've been able to reach out to. Of course, you see people both locally, nationally on a regular basis, but through this campaign, getting a chance to, I'm sure, interact with many more people, hearing their ideas. I've got to think that's something rewarding for you and something you can take forward down the road.
Absolutely. Across the country, there was a lot of positivity for my message of a balance of fiscal responsibility and social compassion, about standing up for the rights of all Canadians, and about the positivity and the respect that we need to bring to one another in this country. I think that's where Canadians are, and although I did not have enough support to get on the ballot, I do think that that is the message that will take us forward.
When the dust settles, I know this is still fresh, at some point, will you consider endorsing one of the other candidates?
No, I'm happy to let the grassroots Conservative members figure out which of those that are on the ballot they would like to have lead them.
Marilyn Gladu, we appreciate you joining us, and stay safe for both you and, of course, all your staff there.
You as well. Stay safe.
There's Sarnia Lambton MP Marilyn Gladu. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Well, whether it's during a pandemic or any time of year, donating blood is a very important thing that everyone should keep in mind. So joining us now, Territory Manager for Canadian Blood Services, Elaine St. Pierre. And Elaine, I understand as we got into the pandemic, there was certainly a lot of challenges. Now things have, I'll say, improved a little bit. But bring us an update, what you've been dealing with at Canadian Blood Services, especially over the past week or so.
So it was initially very concerning to us because when everything started to sort of be locked down, we did see a very high number of appointment cancellations, both from individuals and groups. And so since our call to action on March 16th, we have seen a notable increase in blood donations, which has allowed us to maintain our inventory in the short term. So right now, it's very important to just note that this is a bit of a marathon and not a sprint. And we are going to need blood donations in the coming weeks and months. And so we're really thankful for Canadians to responding, to that call to action. And we would like to ensure that you continue to do so.
I guess that's the thing. At first, people maybe as they were first isolating and working from home, I understand even though the Prime Minister, when he made comments about donating blood as well, just, definitely helped remind people that no matter what is going on, there is still that need.
It's true. Mr. Rogers says that, when something disastrous happens, you look for those helpers. And without a doubt, those blood donors are the helpers in this situation. And it certainly was an idea that people did latch onto. And we're so very thankful not only to see a number of new donors, people who have never donated before, but what I like to call first time in a long time donors that have maybe not donated in many years. And it has been a great reminder to come back into the system and know that it's a great thing to do.
For people, as you said, that may be first time or first time in a long time, tell people the importance. People may not realize the importance and how even going in once to donate blood can make such an impact.
Well, first I want to just remind everyone that not only is it safe to donate blood during COVID-19, it is essential to those patients who rely on blood donations every single day. So when you think about, people still have cancer every day. There are babies still being born every day. There are surgeries still going on and emergencies and traumas. So just really think that even though we're all locked in our homes, there is still stuff going on out there in the world that needs blood every day.
And I guess, and two, one person donating, I've heard, understand, can save many, many lives when you look at just the way the blood is used in terms of, as you said, cancer patients, trauma, you name it. Life is still continuing.
Well, and it's also notable too that, while we do say that blood donation can save a life, sometimes it takes many blood donations to save one person. So just to put into perspective, for example, a car accident victim could go through 50 blood donations in one instance to try and save that trauma patient. Someone with leukemia, for example, may go through 8 blood donations in the matter of a week over the course of the treatment. So it's very important to know that the numbers are very high.
Elaine, as people, using physical distancing right now in terms of being safe, that of course is very important at the clinics as well. What sort of steps are being put into place? You mentioned it's still safe to donate, but I'm sure changing up a little bit to make sure that not only the donor, but also the staff there are being safe.
Right. If you've ever donated before, you know that we ask a lot of questions, and this is certainly no exception. We have put additional criteria in place as it relates to COVID-19 and additional screening measures in terms of, we've set up an active wellness station at the very front door there. So we're going to stop you before you come in. We will ask you some additional questions, make sure that you're sanitizing your hands, and provide some additional instructions. So things, once you're in that environment, I think it's important to note that out of all the branches of the health system, we're generally the place where, healthy people hang out. So, you do need to be well and you do need to be healthy to be a blood donor. We do have a lot of strict criteria. And so we encourage those that are still eligible and able to come out to certainly, book that appointment and keep honoring those appointments as we go along. So in terms of additional screening criteria, best thing I would suggest to do if you're interested in learning about blood donation, if you've never done it before, definitely our website, blood.ca, is the best place to go. And especially around, questions around COVID-19. We've got a whole new section that really drills down and is answering a lot of those questions that blood donors are asking us as it relates to blood donation.
And so what are some of the common questions you're finding people are coming up with?
Well, people are wondering about additional screening criteria and the whole physical distancing, for example. So we have implemented that in our clinics as well. So, the numbers on, how many people we have in the room, we're really trying to, take that advice of public health. We do take it seriously. So we've sort of spread out our events a little bit in terms of spacing. So you will find that when you come into our donor centers, you're not going to be shoulder to shoulder with your fellow donors as you once were. So that is what's probably allowing us to bring in less people at a time. So we're trying to respect those guidelines around the number of people in the room, as well as, the people coming in a regular basis. So the one thing I think I'd like to just mention as well, we are only taking appointments at this time because that does give us the ability to control the people in the room and having that active, open communication with them in case things change on a daily basis, as they sometimes have been. So, we are only taking appointment donors. So if you're used to walking in, best thing to do, go to our website and find a clinic near you and try and grab an appointment.
One of the common criteria, of course, there is a distance between blood donations. For people watching us that aren't aware, what is that criteria?
For distance in terms of
time between donations.
Oh, for sure. Yeah, sorry. So if you're a male, you can donate blood every 8 weeks or every 56 days. And us girls need to wait an extra month. So it's 84 days or 12 weeks for the ladies.
So I'm sure, and even as Canadian Blood Services, the physical distancing, I'm sure working from home in some cases, that's got to make for a challenge, but I guess the technology that we have these days makes it a little easier, just because I'm sure that all the territory managers, keeping in touch and dealing with everything that's going on, I've got to think that's where even among your own staff, working together, knowing, okay, we can still, conference calls and things like that, because we need to keep in touch, because talk about essential services, you're right up there at the top of the list.
For sure. We are running clinics every day, and, our staff that are out there, in the clinics, they're our frontline workers. We're here to support them, and we're really trying to help, guide the flow of traffic and put the messaging out there so that people are informed. They know what's going on with our clinics, when they are, where they are. So we're definitely here backing them up 100%.
Elaine, give us the quick summary. Someone watching right now, they think, yes, I want to donate. I either haven't done it before or I haven't done it in a while. What do they do?
Blood.ca is your first line of attack. If you don't have a computer, you can also download our Give Blood app to your smartphone. All the eligibility criteria as it relates to blood donation, as well as additional information regarding COVID-19, is right there on our website. It will allow you to book an appointment. If you would rather call, if you have some additional questions maybe that you find our eligibility information isn't covering, you can always give us a call at 1-888-2-DONATE.
Elaine St. Pierre, Territory Manager for Canadian Blood Services, thank you for joining us.
Thanks for having us.
That was Elaine St. Pierre, Territory Manager for Canadian Blood Services. Certainly very important to consider giving blood any time of year, but especially right now. Stay tuned. More to come. You are watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily here on your TV. The Inn of the Good Shepherd is conducting a drive-by food drive this week to help stock the shelves. Donations were picked up in Sarnia today from areas north of Highway 402, along with Point Edward. Friday will be the remainder of Sarnia, south of the 402, and then the drive-by food drive wraps up on Saturday with Brights Grove, Wyoming, Petrolia, Corunna, and Aamjiwnaang. The idea is that people leave their non-perishable food items on the front porch and leave the porch light on during the day so the drivers know there is something there for them to pick up. Miles Vanny of the Inn of the Good Shepherd says the organization is adjusting after having fundraisers canceled due to the pandemic. Miles Vanny sat down with Kelly Ash in our studios recently on an episode of Talk Local.
Our old model was coming in and giving people that
Shopping.
dignity of choice and selecting their things, but we recognize that's a system that brings people conglomerating together, and that's not safe. So we've done the same thing. We've pre-packed food boxes now. Not the way we usually do it, but it's the best way to get food to people. So again, they just come to the door in the morning during the regular food bank hours, and we can hand them a box of food. We have a table set up right in the vestibule with fresh vegetables, with milk, with eggs, so we're getting that nutritious, healthy food to people as well. But they can go home with a food package now.
Where are you finding milk?
Well,
it's crazy.
Oh, I know. Milk, bread, eggs, scarce in the grocery store. And that's one of the fortunate things with the food bank network we have provincially and nationally. We have commitments from the dairy farmers to provide milk. So every 2 weeks we get a shipment of milk, and thankfully that process is still carrying on for us. As long as they are in a position to be able to produce that. If they start to lose workers or whatever, then that might come into question as well. But at this point, our eggs and our milk came in, and we're good with that.
Have you, because you've been doing this a long time,
yeah.
Can you remember anything like this ever happening before?
Even when H1N1 hit, and that would be probably 10 years ago.
Yeah.
We had done a pandemic plan for that, and to kind of do exactly what we're doing now. It didn't get to the stage that we needed to do that, but we were ready for it. So when this started to unfold, and so rapidly, at least we had that plan in place. We were able to dust it off, tweak it a little bit, and we were ready to run with it. But yeah, I can't imagine. We never got anywhere near this stage during H1N1.
Even after 9/11, it didn't get like this.
No.
Like
for us, probably our biggest rush was when the Kenwick building caught fire, because there were a couple hundred people shoved into hotels in the downtown area that we had to take on the responsibility for feeding every day and providing hygiene items and clothing and that sort of stuff. And that was a week of 18-hour days trying to make sure all those people were fed. This outstrips this because this is going to be longer lasting.
Let's hope not. Australia's going to cure us.
Yeah, well, that's hopeful. The other aspect we're finding is that we hadn't had to deal with when H1N1 or with the Kenwick fire is that we had the supplies and the stock to do that, and the community came in with resources to help us, particularly clothing and that. But in this case, we've lost major food raising events and fundraising events. We've lost Cyclone Aid, which was supposed to happen on the 28th of March. We can't do that. We've lost construction. We've had to cancel that.
Oh,
and
I never even thought of that.
We couldn't even postpone it because it just was trying to coordinate teams at other dates.
Can't do it.
So between those two events alone, that's 80,000 pounds of food, almost 2 months' supply of food gone in a matter of a few hours of
so 2 months of food supply gone. And increased
need. And that's 2 months just from those two events. But now that churches are closed and schools are closed and businesses are on restrictions and they're all collectors of food for us, we've lost those sources as well. Sunday mornings, lots of churches would have a basket at the back of the church and people would leave some stuff and we'd get that every week, and that's all gone now. So when you look at about a food value, a dollar value, and the fundraising we've lost, at this point we're at about $250,000 loss. And so it's not just how are we planning to deliver our services, it's about how are we going to have the resources to continue to deliver those services.
Well, that's going to do it for Sarnia Lambton Daily for this Thursday, March 26th. We're with you every weekday during the pandemic at 6 o'clock here on Your TV, or check us out on the Your TV Sarnia Facebook and YouTube pages beginning at 7. I'm Terry Doyle. We'll see you tomorrow.